right, now that the 3 cases of the new coronavirus have been confirmed in Cuyahoga County, we have an infectious disease expert in studio with us this morning. University Hospital's Dr. Keith Armitage. Sir, thank you so much for taking some time out to be here with us this morning. Yes. On the heels of that news, a lot of people wondering, perhaps has the new coronavirus been circulating in our community for a while now and we didn't know? What do you say?
I don't believe it has. We know these 3 cases were acquired outside of Ohio, and we haven't been seeing cases come in with no link to travel or a known exposure. So up until now, there's no evidence that there's community spread in our community.
Okay, what's important now to happen, the next step for containment?
I think what's key is that these 3 patients obviously will be isolated, but their direct contacts, people that had direct contact with them, need to self-quarantine for 14 days. That's crucial from keeping this from spreading.
Yeah, and you said, how does that work? The health department reaches out to those people?
Yeah, public health authorities will identify the contacts of these 3 cases, contact them, and advise self-quarantine.
Let's talk a little bit about how might this end. Well, let's go to that graphic from Johns Hopkins University. Not really graphic, but it's in real time, keeping track of the amount of people who have been sick worldwide, the amount of people who have recovered. Where this began in China, Doc, we see the numbers starting to go back down. Yep. Does that give us any indication of how this new coronavirus outbreak might finally come to an end? Will we see cases slow down, and how it might play out here in our community?
I think it's still unknown. On the one extreme, you have Italy, where is a modern industrial country. We seem to see a lot of spread. I think the hope is with social isolation, we can contain it and keep it from spreading. I think it's important, if there is community spread, the most vulnerable, people over 60, elderly people with comorbid conditions, need to socially isolate once there's community spread. That's
important to note. Let's talk about that a little bit more. For some people, this doesn't even impact them much, but for other people, this could be potentially a deadly infection.
What we've learned is it's a mild illness in children, very few serious illnesses in children and young adults. In Italy, the average age of fatal cases was 80, so it tends to affect people with underlying heart and lung problems and people who are frail elderly. So I think it's reassuring about our children, but it's concerning about our parents and grandparents.
Okay, so what do you want to tell those people right now, the people in our community? What is the most important thing that we know and we can do right now?
People should pay attention to the public health authorities and listen to their guidance about social isolation if it comes to that. The contacts of these 3 cases need to self-quarantine. And I think young, healthy people, should not be overly concerned about a fatal illness, but people who are frail and elderly, if there is community spread, do need to isolate.
And we need to be mindful for them too on their behalf.
Yes, and that's one reason why they're closing schools. Not that the kids are going to get very sick, but they'll take it home to their parents and grandparents.
So we'll see what happens here at home as this progresses.
It's a very rapidly evolving situation.
Okay, Dr. Armitage from University Hospitals, we really appreciate your time this morning.
Happy to be
here. Thanks so much.
Thanks.
All right, and again, if you have questions, here is the number you can call. The Ohio Department of Health, they have this staffed 7 days a week. They have daytime hours. This is the number to call, 1-833-4ASK-ODH. Health officials, again, they're from 9 until 8, 7 days a week. All right.